Hello, this is Sharon Garrett. Today I'm going to talk about the Certified Nurse Educator's detailed test plan and some different teaching strategies that can be creative to help students learn some of the different categories that are in that detailed test plan. Number 3 category is assessment and evaluation strategies. So the activity that I came up with for this was inspired by a CUSIN activity that I read about by Kathleen Fries, and she posted this in July of 2012. I had searched on the CUSIN competencies teaching strategies and found an article that she had posted on reflective clinical journaling using the CUSIN competencies to promote student self-awareness. And so I developed an activity sort of inspired by that thought process. So after the first week of clinical, ask the student to complete a survey that you've created in SurveyMonkey. And this can be done using a five-point Likert scale. So you would have strongly, disagree, neutral, agree, and strongly agree. Then you would develop a clinical assessment tool that you will assess your students on and inform them that the areas that they'll be assessed on in the clinical live rotation will be the same areas that they're going to do a survey on their knowledge and their competency of where they think they're at and meeting those learning objectives prior to going into the clinical. But I set it for the first week after clinical because I think there's a lot of anxieties and uncertainties going into the clinical setting. And so after 1 week of clinical, I think this would be more appropriate for them to go in and complete this assessment, this self-assessment. This is a subjective self-assessment that they'll do. So the first area that we would survey would be their assessment skills and how they feel about that. We would ask them to respond to whether or not they feel they can demonstrate knowledge in completing a physical assessment and interview of the patient. And then secondly, are they aware of normal and abnormal findings and how to report those? Documentation would be another category. Can they complete appropriate documentation on the patient findings and of the care that they've done? And are they incorporating appropriate medical terminology and abbreviations? So again, we'd have two areas that we ask them to score themselves on under documentation. Patient safety, always a big focus for clinical. Patient safety, demonstrate, one of the things we'd ask, do they feel that they demonstrate safe practice while providing care? And secondly, are they providing patient education where it's appropriate to have the patients be safe? So are they, giving them verbal and physical cues when they're working with their patients to remind them of various safety things like using their call light, making sure they have their locks on their wheelchairs, and whatever that may be. Plan of care. Do they feel that they can identify through the assessment how to write appropriate nursing diagnoses, how to write a plan with their goals for that person, short-term, long-term? Can they write out implementation steps, and can they go through that evaluation piece? And they would do that on an assigned patient. Teamwork. Do they feel that they demonstrate the ability to work effectively and collaboratively with their co-students, with faculty, and with facility staff while they're meeting patient care goals? Communication skills. Do they feel that they communicate effectively to meet the patient's needs and to work collaboratively? Time management. Always a struggle for new nurses and nursing students. Time management, do they feel that they are going to effectively complete tasks on time? And secondly, do they arrive to clinical on time? That's another piece that I wanted to add. Professionalism, Do they behave and act at the clinical rotation or at the clinical site in a manner that would represent professionalism? Are they dressed appropriately? Are they using appropriate behaviors and language while they're in the clinical setting? And secondly, do they treat the patients and others that they're working with dignity and respect? So those would be the areas that we would ask them to score themselves on SurveyMonkey 1 week after clinical. Then we would complete our clinical rotation for whatever clinical setting that would be. And so after they've completed that rotation, then they'll have there's 5 things that will occur. Number 1, the student will be asked to go back into SurveyMonkey and complete the exact same survey, and so that we can do a comparison for them and when we give them their overall one-on-one evaluation. Secondly, the students complete a clinical assessment tool. So all of the things that I just described, all the different areas that they are the criteria that they're being assessed for by their instructor in the clinical setting, we would give them that same tool and ask them to go ahead and write down on there as well what they felt that they had completed. Students then would be asked to post a reflective journal paper on what impact the clinical rotation had on their learning experience and what they felt that they contributed to the clinical site. So not only what did they get out of it, but what do they feel that they contributed back? Because every student provides a contribution when they're at a clinical site, and by doing a reflective journal piece and looking at how, not just what happened to them, but how it affected them, it provokes them to do deeper thought process and self-reflection, self-critique on the areas that they could possibly improve in. And it also it invokes them to ask searching questions of that experience. So they would write a reflective journal paper. Fourth, the instructor would complete their evaluation, their clinical assessment evaluation. That's something the instructor would do. And then fifth, the instructor will schedule a one-on-one meeting time where they will go through and provide that student with feedback, and they will compare the SurveyMonkey evaluations for them, which they can discuss with them and dialogue with them on how they scored themselves from 1 weekend to the completion. And hopefully that will demonstrate their confidence and their own skills and their own knowledge and competency. And the instructor then will go through their clinical assessment evaluation as compared with the students and see what gaps may be there that they can discuss and dialogue. Maybe there were areas of concern that the instructor identified that the student doesn't have a self-awareness about, and so that would be a good method to do that. And then lastly, they would discuss the student's reflective journal and just what types of experiences came out of that, and provide maybe some additional questions to seek or draw out how that experience was for them. So that is the strategy, the teaching activity, learning activity that I came up with for assessment and evaluation strategies. Thank you for watching my video.